So, ladies and gentlemen, welcome back to this channel. I want to take this opportunity to wish you all a happy Easter from wherever you're watching the video from. So, if you're just stumbling upon this video, kindly consider subscribing, sharing, and liking, and comment down below what your thoughts are about this channel and our content. To the returning subscribers, thank you so much. Keep it locked as we continue enlightening each other. So today we are going to talk about infertility. I'm going to give you an overview about infertility and what you need to know, what ought to be done in some certain scenarios. So we are going to begin this episode by a case study, or rather a story, which I'm going to give you, after which I will take over and explain to you what you need to understand about infertility. So our story is about a lady called Jane, who is 28-year-old female, and she's a patient. She has been married for the past 6 months. Her husband lives in a different town, but every weekend he is at home. She expresses her concern to you that they have been trying to conceive for the past 6 months without success. They use the calendar method to know when she is ovulating so as to increase the chances of conception. She has no chronic illnesses, no history of surgery, that is obscene. History of menarche was at 12 years of age. Her menses are regular with a cycle of 28 days. No history of contraception. Her vital signs are normal. On examination, she is normal. What will be your next course of action or advice to Jane? So typically we are seeing a story about a lady called Jane who has been married for the past 6 months, the period during which she has been trying to conceive. They live in different towns with her husband, and every weekend they meet, but they have not been able to conceive. So the best answer to give Jane is that they should keep trying, and 6 months is not enough to know whether somebody is infertile or not. So that brings us to the definition of infertility. So infertility can be merely defined as 1 year of regular and protected sexual intercourse in which pregnancy is not achieved. So as simple as that, we get to understand that for Jane's case, they had only been trying for 6 months. So they had not completed the cycle of the entire 1 year. So there was no cause for alarm. However, this definition of 1 year could have a slight difference when it comes to ladies who are of the age 35 and above. So it goes that for a lady who is 35 years and above, who has been having frequent, or rather regular and protected intercourse for the past 6 months and have not achieved pregnancy, then that can be declared to be infertile. So for ladies who are 35 years and above, for a period of 6 months you've been trying to conceive and have not been able, then that could be declared to be a case of infertility. So infertility can be classified into two. We can have primary infertility and secondary infertility. Primary infertility is a scenario in which both couples, rather the man and the woman, have not achieved successful pregnancy in the past. Neither the female has conceived nor the husband, or rather the man, has impregnated someone in their past lifetime. So secondary infertility can be defined as a case in which either of the partners has achieved successful pregnancy in the past but is encountering difficulty to get pregnant or to conceive in the present time. So it means that either the lady got pregnant in the previous years, but currently she is trying to conceive, but she is not able to. Either the man also impregnated somebody somewhere in the past years, but currently as they are trying with the wife, they are not able to, or rather they are having difficulties. That is what is defined as secondary infertility. So it is important that you know those differences. Another term that we need to be conversant with is what we call fecundability. Fecundability is the ability of a person, or rather a couple or a normal couple, to attain pregnancy within one menstrual cycle. So this is normally difficult, and it is only 25% of people who achieve this fecundability. So it is not an easy task to go by. So it is important that you get to understand all these factors. So what are the causes of infertility? So causes of infertility get split along male and female and given proportions, and it is important for infertility to occur. There are male factors and there are female factors, and each of these factors accounts for a given percentage. So combined factors, that is male and female factors, account for total of 40% of infertility causes. Male factors alone account for 30% of infertility causes. So female factors, we have ovulatory dysfunction or ovulatory disorders that account for 25% of all the cases. We have tubal disorders, or rather the disorders within the fallopian tube, that account for about 20% of all the cases. And there are other factors that is 10% of all the cases of infertility. So from that distribution, we get to understand that also males could play a part in cases of infertility. So what are the female factors that could lead to infertility? So female factors are broadly classified into three major categories. So the first category is what we call ovulatory dysfunction or disorders. So these are disorders that arise due to hormonal changes in the female body that leads to ovulation and subsequent menstruation. So what are some of these ovulatory dysfunction that we may get, or rather a female should get concerned or look up to in herself? So the first thing that could arise under this category is what we call amenorrhea. Amenorrhea is absence of menstruation. So if you're a female and you're not menstruating, there's a high risk of being infertile. The next condition under this ovulatory dysfunction is what we call hirsutism. Hirsutism is a scenario or a situation in which a female could have hair in their bodies in places where they should not be having hair. The hair may develop in the chin, the sideburn, or rather the area of the mustache. So that is what we call hirsutism. The third thing under ovulatory dysfunction is irregular menses. Irregular menses could arise because now you find that in one particular cycle you are menstruating more than once, or your menstrual cycles could cut and it takes a long time before you menstruate again, or it is just not regular. The periods tend jumping from one date to another. So that is also another thing that could arise from this, and it is majorly because of hormonal issues. The other issue under this category is what we call obesity, that could lead to what we call polycystic ovarian syndrome, something that we will talk about in our forthcoming videos. So it is important that you get to understand all these factors: amenorrhea, hirsutism, irregular menses, and polycystic ovarian syndrome, or what we call, that is more normally predisposed due to obesity. Now, the second factor under female factors is what we call uterine abnormalities. So the uterus is where the fetus tends to grow during pregnancy. So any abnormality within the uterus could lead to an infertility. So what are some of the abnormalities that may arise in the uterus? The first one is dyspareunia, that could be loosely translated to painful sexual intercourse. So when you're having sex and you're feeling some sort of pain in the lower abdomen, it could be there's an issue within the uterus. Another issue could also be infections. Another thing that could arise due to uterine abnormalities is what we call dysmenorrhea, or rather painful menstruation. And the third thing that may arise under these factors is what we call uterine fibroids, or rather abnormal uterine growths. You see, when you have uterine fibroids, on the uterine walls, it makes implantation to be difficult because now the fertilized egg cannot be implanted in the walls of the uterus because the walls are being covered already with fibroids. So the fibroids are making implantation to be somewhat difficult. The final bit under these female factors is what we call tubal obstruction or tubal abnormalities. So tubal abnormalities, the fetus, the female has got the ovary that produces the eggs, or rather the ovum, and it feeds it into the fallopian tube where the eggs travel into the uterus. So these fallopian tubes could have abnormalities that could range from a number of issues that could lead to blockage of the fallopian tubes. So if there's a blockage within the fallopian tubes, it could predispose you to infertility because fertilization will not occur because fertilization takes place within the fallopian tube. And again, the ovum, or rather the egg, cannot be transported properly from the ovary into the fallopian tube and subsequently into the uterus for implantation. So some of the things that could lead to these tubal blockages could be a number of issues. The most common one is normally ectopic pregnancy. So when you have ectopic pregnancy, or rather tubal pregnancy, instead of implantation taking place within the uterus, the fertilized eggs tend to be implanted in the fallopian tube. And this, if not treated on time surgically and the issue controlled, it could burst, and in some fatal cases it could lead to death. So during these surgeries of this particular condition, that ectopic pregnancy, after the surgery, during healing, the healing may be so much until the fallopian tube could have adhesions and subsequently leading to blockage. And when there's that blockage, that is when now fertilization becomes an issue. Other form of infections could also lead to tubal blockage. Issues like gonorrhea could begin to ascend, attack the uterus, and subsequently lead up to the fallopian tube, and thus causing blockages or obstruction. Other issues like pelvic inflammatory diseases could also affect that and cause blockage. So majorly those are the three main factors under the female factors that could lead to infertility. So let us talk about the male factors. So male factors could range for a variety of things. So the first thing in the male factors that could lead to this issue is what we call the injury. And injury mainly to the testicles, or rather to the genitals, or any part of the male reproductive tract. So any form of injury could lead to that. The next thing is chromosomal abnormalities in male. That is issues like Down syndrome, what we call XXY, such that somebody is a male that he expresses more feminine features, meaning that she has more estrogen circulating in his system more than testosterone. This could lead to infertility. Another issue is exposure to toxins and dangerous rays like X-rays. You know how the testis is normally hung. They are normally hanging within the scrotum. So at that point, they are easily exposed to a lot of hazardous materials that could hinder sperm production. Also ingesting some of the chemicals or other toxins, either during places of work or in an array of situations, could lead to hindrance of sperm production. Another thing is smoking, alcohol intake, obesity. You know, when you are obese as a man, it means that the estrogen levels in your body could be so high. And you see, these hormones operate in a counter-regulatory mechanism. When one is high, the other goes low. So when you have more estrogen as a man due to obesity, it means that testosterone levels are going to drop, and eventually you're going to have issues with fertility. The other issue is old age, which normally don't affect most of the men, but you know, the older, the weaker, the younger, the stronger. So old age could also play a part in males. It is also important that we add another thing there in males called the systemic diseases. There are diseases that affect the entire body, in a big way. So if such diseases could occur inside a male, they could eventually lead to infertility. And majorly, some of the medications or diseases or tumors that affect the pituitary gland or the hypothalamus, because in the pituitary gland and the hypothalamus is where an hormone called gonadotropin release hormone is being produced. So this hormone is what normally stimulates testosterone production. So when a disease or any medication affects the pituitary gland at the point where this gonadotropic releasing hormone is being produced, it will lead to a deficiency of gonadotropin hormone. So when there is a deficiency of gonadotropin hormone, it eventually means, in simple terms, so that I don't confuse you, the male will end up not producing enough androgens, which are the testosterone. And these are what is important for the process of sperm production and making the man a man. So it is important that you understand that. It is also key that we understand that in most cases of infertility, it is the lady who will present to the hospital first. But just as I have said before, fertility is a collective responsibility, because we saw that males also contribute about 30% of factors to these causes of infertility. So it is unfair if females get victimized in most of the cases which normally arise, yet the problem would also be in the males. So if you are having any of these issues about infertility, it is important that you get checked and get open with your partner. You can just begin by diagnosing yourselves and getting to know where the problem could be. So for us, when you come in, we will get to listen to you and get to understand, especially for you as a lady. We get to understand the first things first. Is your ovulation in check? Do you have regular cycles? Are you obese? Do you have painful menstruations? Have you ever conceived in the past, regardless of the outcome? That is why it is important that you talk to your partner. You could have conceived, but maybe it ended in a miscarriage or rather an abortion. That is also important to us, so that we get to distinguish whether an infertility case is primary or secondary. Is it possible that you have been using some form of contraception, especially the contraception that I normally not advocate for in my case is Depo-Provera? If you can avoid it, the injection that is normally given in the upper arm, that is once, that goes for 3 months. There are a lot of cases of infertility that arises from that. So it is important that as a lady who has never conceived or who still wishes to conceive, please avoid that particular kind of an injection, because it may predispose you to infertility. So as a lady, we get to check all those your menstrual history and everything, whether you've ever conceived past. But if everything is okay and you come within 6 months, we normally reassure you and tell you to continue trying for the next 1 year, so that after that you come back. What about if it is the case of the man? Just as I had told you in male factors, one of the factors that I failed to mention, and that is what we call anatomical variations. So anatomical variations is how the genital tract have been created by God in its own way. So you can also take time and examine your man in this particular manner. There are conditions that normally arise and people may tend not to identify them earlier. One of them is what we call undescended testicles. When you touch your man under there, you will be able to feel the 2 testes. But in the event that they're not there, or they're not of the right position, then it means that they have not descended well. So if a man has got undescended testicles, therefore it means that that could be the cause of infertility in him. Another issue is what we call hypospadias and epispadias. When you look at the penis, there's the point where the urethral orifice normally opens to the outside environment. It should just be at the tip of the penis. But there are some cases where it could be located just above, or some cases way below, such that it is not in the midline, just at the point where it points forward. So such cases are normally correctable, but because of stigma and everything, you may find that somebody is growing in such a condition until they reach the age of childbearing age. So it is important that you get checked and these issues get corrected as a man. Also, in a man, it is important that even as we check those anatomical variations, we also check your physiology as a man, whether you are exhibiting secondary sexual characteristics like deepening of the voice, also the development of various muscles within the body, so that you know that your hormones are really okay. So it is important to check that. So those are things that you can do with the naked eye at home. So if you check all those and they're in check, and you continue having regular and protected sexual intercourse for the next 1 year and there is no outcome, then the next phase is to go back to the hospital. And also to the man now, we could do what we call semen analysis. And in semen analysis, there's what we normally look for: how the sperms swim, the quantity that they are, and also their quality. And all this will be covered in our next episode about this particular series of infertility. So generally, I just wanted you to just have that overview of what could lead to infertility, and also in females and in males. So up to that point, I call it a day, and kindly consider subscribing, liking, sharing, and let us meet in the next one as we dissect further what we normally look for and the investigations that we will order in the event that somebody fails to conceive in the first 1 year of trying to get pregnant. Until next time, it's Kowegido.